Before I show the development of HIFU in prostate cancer, I just want to put some attendance to different starting points which we had. So the whole project started in cooperation with INSERM, with the University of Urology in Lyon and in my department in Munich. And the start was 1989. So we went, and that was mostly Albert Gelée in Lyon, through the animal experiences, which were closed somewhere around 93. Then the development started from 95, where IDA was able to deliver kind of a prototype for this device. And we started 4 centers, a European multi-center study, which I will show you next slide, a little more the results. Then the CE labeling of the Applicative happened in Europe in 2015, as mentioned just prior. The FDA approval for prostate tissue ablation was achieved, and situation now is there are 60,000 Applicative treatments worldwide done in 300 hospitals all over the world. Okay. This slide shows you shortly the summary of the European multi-center study with the first prototype, and we were very optimistic when we got the results. 86% in low-risk cancer, negative biopsies after the treatment, even in middle risk, 81%, and as usually whatever you do with high-risk patient in prostate cancer, 72%. Still negative biopsies after HIFU treatment. That shows just the different technology which we had available till today. When you see, and there is a significant difference then, because from 2000 on, we integrated the transfer to resection of the prostate in the treatment schedule, and something is very weak with that. Good. Why TURP? It removes calcification abscesses, middle lobes, and the inner sphincter, and reduce the risk of having strictures after the pregnancy. And furthermore, it also increased the application of bigger size prostates up to 120 grams. And on the other side, after resection, as you see on this lower picture, you can compress the prostate, and then you can reach the anterior lobe of the prostate. So total radical HIFU is possible much better when you have done a TURP before. That are the data which we achieved with this technology and with the resection, and that is a maximum follow-up of 14 years. As you see, we could meet the expectation which we had from the first multi-center study, and even if we followed these patients 14 years, we had nearly similar results like we had in this short-term observation in the beginning. And that was not only a situation in Munich, as you see here, 2030, Ganser, we, our group, Chaussy, published these long-term results for first time, HIFU, and when you look, the data were very conclusive and identical on different centers from different groups. So the next step was to extend the indication for Applicative HIFU, and what you see here is the localized prostate cancer, which was the first group, HIFU in incidental prostate cancer, then salvage HIFU, which I will bring some results in a later presentation, palliative adjuvant HIFU, and even HIFU in hormonal resistant cancer. And because of reason of time, just want to show you our experience in 130 patients with a T3, T4 tumor. The summary out of that is that 96% of the patient remained without ETTA, and we could reduce PSA velocity significantly. In these patients, even after longer observation time, they didn't need anti-hormonal therapy. Now, what I mean as kind of a summary, I think a lot of things have changed in the treatment of prostate cancer. While 20 years ago, we had to observe a patient for approximately 7 years and treat him, while meanwhile, because of the earlier diagnosis of prostate cancer and the longer life expectancy, we have to take care of the patient over 20 years. And that, I think, is the need for multifocal, multi-modality treatment, which we have, including HIFU and other treatment and modalities for prostate cancer. So, summary, HIFU seems to be highly attractive as a minimally invasive treatment for prostate cancer, either as a primary or salvage therapy. HIFU to be feasible in various focal and radical indications of treatment of prostate cancer with promising oncological results and limited morbidity, and the technical development of devices with new ultrasound technology or MR guidance will increase the role of this strategy in the near future. Thank you.